All right, ladies and gentlemen, day 3 of this, and I just wanted to say thank you for those who are actually watching these in full length. The amazing thing about using a private sector platform is I get to see all the metrics when I check these files. It's amazing actually seeing the average video watch time, how many views, etc. Not to mention, if you guys really want, you can give me feedback in the comments. It's up to you. Just a way for us to keep in contact and the craziness of what's going on, right? So feel free to hit me up and I'll do my best to get back at you with any questions you may have. Today's training, we're going to focus on your Corpsman manual, Navedtra 14295, Chapter 9. Okay, Chapter 9 is preventive medicine and infection control. Now, I'm not going to be going over the entire chapter here. We're going to only be touching on primarily infection control, and the reason is twofold. One, obviously, we've got all the COVID-19 things going on, so it's a good thing to just kind of refresh our memories on, as well as just some chatter back up at the 62 area, just touching base on how we should be conducting ourselves at the RAS and things that should be expected of us, right? So references for infection control are NavMed P5010, BUMED Instruction 6220 nosocomial infection program, and the BUMED 6610 dental infection control program. All right, so next week we're going to be going into a training that talks about how to study, but the amazing thing here is Chapter 9 literally lists those programs that you can go use for reference and further education on this. So it's all in a book. Infection control terminology, standard terminology right here. I'm not going to read this off to you guys, but things that you should be aware of so you understand what we're talking about. Biggest thing is sepsis is the state of being free from pathogenic organisms. Infectious microorganisms are the organisms capable of producing disease in a host. PPE, we should all know what PPE, and kind of the random thing here is the other potentially infectious materials, OPIM. You may see that acronym as we kind of go through this stuff. So that is what that stands for. Just keep that in mind. Now, the other thing is disinfection, to cleanse something so as to destroy, prevent growth of a disease or carrying microorganism. That is the whole point of this today, right? So in order to do that, we've got to follow standard precautions, all right? They're intended to reduce the transmission of microorganisms from a recognized and unrecognized source of infections. These are just basic things: hand hygiene, personal protective equipment. Hand hygiene, pretty simple, right? This is something that we all kind of take for granted. All personnel must assume that all bodily fluids, contaminated instruments, and contaminated materials are infectious whenever they handle them. Okay, that's just something that you should always just think in your state of mind. It's the same thing as if you were to pick up a firearm here at Division. You're going to treat it as if it was loaded, right? Same thing here. We're going into hand washing is the most important procedure in preventing the transfer of microorganisms from one person to another. It is literally the easiest thing you could do. We always get on everybody else for it, so we need to stay on it ourselves. So it should be done at the beginning of the day, after each encounter, anytime you use the restroom, etc. Hand sanitizer really is made for when you're not around a sink, right? It's the best case scenario. Moving on to PPE, we're going to start with gloves. All right, so there's 5 gloves that your manual talks about. They are sterile, underglove, procedural, which is manufactured to be like a sterile glove, okay, to the same kind of standard, but it is not actually sterile. Once again, I say a procedural glove is not a sterile glove, okay? Latex examination glove and the nitrile gloves, which is pretty much an examination glove. It's just the alternate to latex, right? So these are the basic gloves that we use, and they should be used at all times. Every time that you complete a treatment, you take that off and you re-glove before you start another treatment with another individual, okay? Combined with hand washing, that reduces 60% of transmission. It's an amazing thing, right? Face mask. 3 face masks that we're going to touch on. This is kind of important for what's going on in the world right now. Is you've got your surgical mask, cone mask, and N95 respirator. So wearing a face mask or a full-length face shield with a face mask during any patient treatment with aerosols, particulates, and splashes when possible to avoid contamination and infection of yourself. And if you hone in on the underlying part of each one here, so surgical masks focus on droplets and aerosols from the wearer's mouth and nose. So this is why we hand them out to suspected patients that are sick. It's not necessarily to protect them or us from inhaling something, it's literally to trap whatever funk is going on inside that mask. Okay, a cone mask, it's a little stiffer, more tightly woven material. It's protection from splashing and aerosols, slightly better. And then the N95. Anybody who's been at a hospital, you should have been fitted with an N95. In reality, we should have N95s probably at the RAS here for us. But hey, Greenside's a whole nother animal. It's the actual mask that prevents the wearer from viruses and small particulate matters. So these are the amazing things that, well, there's just a huge shortage of them right now. And hopefully they get caught up on them. Now, the next part of this whole infection control process is the transmission based precautions. And there's putting this into real time context is the COVID-19. Okay, so when we're going through this, that's what I'd like you to kind of think about in the back of your head is how what we're about to go over actually translates into the real time and what you're dealing with on a day to day basis, not only at work, but outside of work, right? So we'll be covering airborne droplet contact and the mitigation to all of that. Starting off with airborne, um, big thing here is pay attention to the bottom two bullets on this, okay? All medical personnel are supposed to wear an OSHA specified respirator, such as an N95. And once again, placing that surgical mask over the patient's nose and mouth while they're transporting. Once we, identify someone who's COVID positive, or not potentially COVID positive, excuse me, we give them a mask and say, hey, head down to the hospital to go get tested, right? Once doc says, yep, you're good, go to the hospital, go get that swab. We got to do our best to avoid the transmission of that disease and infection from one host to another. All right. So airborne transmissions have to do with the evaporation of drops that can remain in the air for long periods of time or is spread by dust particles. Okay. If you've ever seen the movie Outbreak, okay, that's what we're talking about here. Uh, Horrible movie, but you can go check it out on Netflix. It's a good example of what airborne transmission is, but you'll kind of put it together. So that's kind of the perk of all this COVID-19 craziness is there's all sorts of crazy movies out just to hype the hysteria up. But if you take away the theatrics of it, the bottom line is there's a little bit of truth in what they're talking about and kind of helps portray what could be reality. Could, emphasis on could, right? Droplet. So next one, once again, focus on the bottom two slides here. All healthcare providers should wear a mask within 3 feet of a patient who is presenting droplet precautions, which means they're infected with a microorganism that can be spread through coughing, sneezing, or talking. Best example of this is your common flu virus, right? This is originally what they thought COVID-19 was like, and how it was spread. As you notice, like our precautionary distance increased from 3 feet to 6 feet, right? That has to do with the aerosol. And same thing, you'll notice is kind of reoccurring is putting the mask over the patient's nose that's sick, okay? Reducing that transmission. Last is contact precautions. Contact precautions are the colonized organisms that can be transmitted via direct contact. Okay, so uh, MRSA is a good example of this, especially in the hospital. You got to watch out for this. Um, Oddly enough, in the movie Contagion, which is better than Outbreak, if you ask me, it could just be because it's newer. I think it's also on Netflix. Check it out. Um, but they talk about fomites that it's based off of contact, like somebody touches something and all of a sudden they eat some peanuts or whatever and bam, they're sick within 24 hours. Highly exaggerated, but it's a good example of like what contact precautions is. So uh, pretty straightforward stuff. Wearing your proper PE here, and this may be one of those situations where you go into a room and you've got an actual suit like gown that you put on and you take off every time that you leave, okay? It's not just gloves and a face mask. And in that scenario, you may actually need full body protection just to ensure that you're not transmitting outside of whatever controlled private room that individual's been put in. Now, infection control in the treatment room. This should be your guys' bread and butter. The reason I say that is the majority of you have all come from a clinic or a hospital. And I would expect anybody from a hospital to be able to follow these procedures by muscle memory. Just as I expect when you leave division, you should be able to conduct combat reloads and hit center mass on a rifle target. All right. So we're going to be talking about this in 3 parts. So the important thing here is hopefully it's just touching and review. If it's not touching and review, you need to realize this is the standard that we're shooting for, okay? It's an all hands responsibility throughout the day. There's no excuse for this, okay? And there can't be any deviation from it. It's just the basic thing that you should all be doing when you're at the RAS or if you're at the BAS, which you shouldn't be doing patient care. We all know that, but say we're in the field tent scenario, clean up. It's pretty standard because if we don't do this, then we're no joke failing, okay? So prep the treatment room. No joke, per our training, we must be able to wipe all flat areas and surfaces, ensure all the trash is empty from the day before, place clean protective barriers on equipment that's difficult to clean, all right? Exam beds, how easy is that one? I can't count how many times I've gone in there and I don't even see exam paper put on there, okay? It's a little attention to details. These are things that can be easy to fix, but for some reason, they're not getting done, okay? This is not only an OSHA requirement and a Navy requirement, but if any of you have ever dealt with the Joint Health Commission before, it's a requirement for them as well. So there's no excuse. So this is where you get anything that you're about to do ready for that patient care, okay? You prep it just like you did in core school, just like you were doing at any other clinic. You prep the room before the patient comes in and you make sure it's ready. This should always be done every single time. Second part of this equation is preparing for the next patient, okay? You must clean and disinfect the previously covered surfaces between patients. If we're supposed to stop infection, and just like I said at the beginning of this training, you're supposed to suspect contamination of all surfaces when possible, okay? This is vital to the whole deconfliction of keeping a room sanitary. And if you think you deserve more than a P, just remember for the verbiage, even in a P sailor should be able to do the following per your hospital corpsman manual. All right, this is literally hospital corpsman manual basic stuff. Ensure the room is clean. Wipe down any patient contact areas. Put away all equipment used from the previous patient. Remove gloves and wash their hands and use antimicrobial soap and replace and clean disposable barriers and set up hand clean pieces and instruments for the next patient, okay? I'm not going to turn this into a session where like you guys get lectured, but take a hard look at yourselves and be honest. Are you doing this or are you not doing this? And if you're not, just fix yourself, right? This is the standard. There's no excuses. Lastly, securing the treatment room. All right, so using the spray wipe spray technique, aka disinfecting from high to low, really high traffic areas, making sure infection control hazards and biohazard bags are getting disposed of properly. You're not having trash overflowing. I'm not going to get really into the biohazard waste of this because that's going to be tomorrow's training, okay? We're going to get more into that. But it's essentially field day, right? Policing your own area, following those good common standard precaution practices, and don't rely on a paid contractor to do what you can do yourself, all right? This chapter also touches on that infectious waste, like I said, but it's going to be covered tomorrow. as well as other instructions rolled into just one training itself. So we'll stand by for that. If you've got any questions, concerns, please reach out. There's other parts of this that I did not go into, which focuses on sterilization and more the hospital type setting. I was just more concerned with touching base on what's more applicable to our lives at the RAS and BAS here. So take it to heart, and hopefully tomorrow's training will be valuable as well to you. All right, we'll talk to you guys tomorrow.